I'm Dan Collins with Mercy Medical Center in Baltimore, Maryland, and you're watching Medoscopy. Thanks for joining us for today's procedure. Today, we explore a special partnership between Mercy Medical Center and Mercy High School, known as the Women in Medicine program. This 4-year program provides Mercy High students the opportunity to observe medical procedures and to meet with healthcare professionals. Students gain knowledge of different medical fields and gain insights into the qualities and skills needed to achieve success in healthcare careers. We are joined by Mercy High School students Jacqueline O'Neill, class of 2025, and Precious Najiri, class of 2026, as well as Mercy pediatrician Dr. Julie Ellis. Thank you for joining us today.
Thanks for having us.
So I'm going to just kind of jump right in, talk to Precious and Jacqueline. What inspired you each to get involved in the program?
When I was in 7th grade and we learned about the skeletal and muscular systems, I already knew that I was super interested in anything medicine and anatomy related. So going into high school, I already knew that that's something I wanted to explore. And I knew that the Women in Medicine program would just be the perfect opportunity for me.
Similar with me, for as long as I can remember, I've always dreamed of pursuing a career in the medical profession. So, I remember, I have this memory of when I was 5 years old. My dad, he's an RN, so he used to bring all these tools back from work. And I found a lab coat lying somewhere, and I took one of his, stethoscopes, and I put it on, and I did this checkup on my brother. So I guess I've just always been interested in that. So when I was applying for high school and I noticed that Mercy had this partnership with Mercy Medical Center, I was like, wow, this is a great opportunity, and I took it, and so here we are.
Awesome. Dr. Ellis, what about you?
So I feel strongly about mentorship as I was lucky to have incredible mentors throughout my life. Knowing from probably high school that I wanted to be a doctor, though not specifically pediatrics, until I was a medical student. But I was lucky to have Dr. Gupperlet, who was our chair of pediatrics here at Mercy for about 25 years, one of the first neonatologists in the state of Maryland, as a mentor all through high school and college. He encouraged me to spend some time here at Mercy with him. Through that, I got to meet Dr. Delcarian, who's our current chair of pediatrics, and spend a lot of time with her as well when she was a young neonatologist, and really got to observe firsthand what it meant to be a doctor working in a hospital. Thanks to that, I continued to be excited about a career in medicine. I think it's incredibly important for young people to have those exposures to get to see what it's like to be a doctor, what it's really like to be in medicine, so that they can decide if it's something that they really do want to do, or just as importantly, if it's maybe that's not something I'm interested in. But the earlier we can have some exposure to know what it's really like to be a doctor, the more that can help with interest down the line.
Well, for the students, what skills are you learning?
The seniors just learned ultrasound procedure, IV techniques, and suturing. And we also get CPR certified every 2 years.
Recently, our class, when we came here, we got CPR certified. We also did a Stop the Bleed training. That was really fun. I really did love that. I think our sophomore year or freshman year, one of those two, we did casting, and I thought that was really cool, especially because I wanted to go into orthopedics. So it's casting bows, and I really did enjoy that. But we've done a lot, yeah.
And what's it like working with healthcare professionals like Dr. Ellis?
I really enjoy the one-on-one experiences that we get. I'm able to ask the doctors as many questions as I want, and all of them, especially Dr. Ellis, are so willing to talk with me and are just so excited that I want to pursue something similar to them.
I feel kind of like what Jackie said. I feel I feel like I'm not intruding. They don't make me feel like I'm intruding here. Like, I feel comfortable, like, engaging in conversation with the doctors and nurses and the staff because they all just, like, maintain this, like, positive energy within the hospital, and I appreciate that, really.
You two, tell me both a little bit, like, how many days a week are you here, or a month?
We go on visits once a month. We normally leave around 9 and come back around 1 or 2.
And what's a typical day like when you're here?
Typically, we do rotations, so each month you're with a different professional. And senior year, we got more autonomy and kind of got to pick where we would go. But the other years, if it wasn't a scheduled activity like casting or CPR certification, then we were just doing rotations in the hospital and getting to know a bunch of different doctors and a bunch of different areas.
Dr. Ellis, from your perspective, how are the students benefiting from shadowing professionals like yourself?
I think that there's lots of different ways that they're benefiting. To me, most importantly, is that they're getting to see what it's like to be a doctor in real time. Other areas that I think are really terrific is that we are here at Mercy, we're a teaching hospital. And what a teaching hospital means is that we have residents from University of Maryland who have graduated from medical school and now are specializing either in various specialties. We also have medical students doing rotations. And when you spend time in pediatrics, on my typical day, you would spend time with me seeing patients in the newborn nursery, so newborn babies who might have issues. Then we'll go to the pediatric floor where we take care of patients there as well. And then we go to the emergency department and spend most of the rest of the day taking care of any kiddos who come in and need to be seen in the emergency department. And you get to be part of our team in pediatrics. Our team is not just me, but we also usually have medical students and pediatric residents as well. So you really get to know what it's like to be not just a doctor who's been practicing now for 20 years, but a medical student and a resident, and what it's like to go through that whole process. So for me, that's invaluable. It was years, I was well into college before I truly understood what medical education meant. And to get to learn that at such a young age, I think is pretty terrific, to be prepared then for the future. Is this something that I'd like to do? Or maybe I'd like to do something different, because there's so many incredible careers in medicine that going to medical school doesn't necessarily have to be for everyone.
Well, it sounds like you guys are doing a whole lot of different things. How do you balance the time and the effort that you have to put into being part of the program with all the other school activities that you have?
Yeah, I'm involved in a lot of things. I'm president of several clubs, vice president of NHS, and I'm a 3-season athlete. But the Women in Medicine program is during the day of a high school day, so I just have to make sure I stay in communication with my teachers and classmates so that the only thing I'm really worried about is missed work instead of missed practices or meetings.
I think as well, like, time management is definitely a big thing. Like, getting PowerPoints from your teachers, maybe notes from your classmates. It's really just time management. I didn't think it was that difficult, but yeah, especially with like extracurriculars and like sports outside of schools and like clubs and stuff like that. But it's really just about staying on like your game, like time management. Yeah, for sure.
Now, when you're completed with the program for a particular year, is there any kind of testing that goes in? How do you show what you learned?
After every year, there was no testing necessarily, but when you come back next year, you can meet with the new doctors again and just rebuild the connections from the previous years and build upon that. Our senior year, we had a graduation where we kind of recapped on everything we've done in a short speech at the ceremony. But other than that, it's just the in-hospital experiences.
The program is really about giving these young women exposure to the medical field in various medical fields, so that they can then enhance their education and make choices for their future.
Now, in the course of doing all this, are there like particular moments that stand out for the two of you? Like something that really like this was the best part of this program, like when we did this or when I did that?
For me, it was 100% my internship over the summer because I'm really, really interested in surgery, and being in the OR, talking to the surgeons, the nurses, and the anesthesiologists, it just reinforced my passion. And it gave me an incredible opportunity to really see what it's going to be like and what I want my future to look like.
Yeah, for sure. I'd say, well, I haven't done the internship yet, but I'm excited for that. But when I was in the NICU, I think when I shadowed in the NICU, I think it was definitely like a great experience for me. Shadowing in all different departments, it was great, but specifically like in the NICU, I was just like, wow, because I saw how like gentle and compassionate the staff, the nurses were, not even just towards the babies, but towards me and towards, I mean, their coworkers too. It was just really heartwarming. I appreciated it, yeah.
We haven't really touched the base on this, but tell us a little bit about this internship element.
So last year over the summer, there were 3 students who earned internships. 2 were with nurses, but I was with doctors. And over the course of the 2 weeks, every day I was with a different doctor or surgeon. I got to see hip replacements, knee replacements. I saw spine surgery and also like endoscopies and colonoscopies. And every day the doctors were just so willing to show me all the scrub techs, and everyone in the ORs were so excited to explain things to me. And I got to see portable x-rays and just real life operations. I thought it was so crazy that I was like in the OR. But it was just such a great experience.
Have you had a chance to go in the OR or?
Not yet. I had the internship, I believe, the first 2 weeks of summer, or second 2 weeks, in June somewhere in June. Yeah, I'm doing the internship.
Do you have a particular field that you have an interest in?
Orthopedics. Yeah, orthopedic surgeon. I'd want to be, yeah.
Well, that's a good field to be in. It's as we see the graying of America, more and more orthopedic issues are coming up.
Yeah.
And someone who's going to be 63 this year, I can testify that yes, and I've had 2 spine surgeries and 1 elbow surgery here. So yes, orthopedics is a good field. Well, thank you. We'll take a break and return tomorrow for the second half of today's Medoscopy, our look at Mercy High School's Women in Medicine program and the partnership with Mercy Medical Center.